Hi, I'm Dr. Eric Broadworth, and I am going to go through sciatica relief exercises for you so that you can treat your sciatica at home. Now, with sciatica, one disclaimer that I want to point out is that if you have been having this pain for greater than 2 weeks, then you should really get into an appointment with a healthcare professional nearest you, your nearest physical therapist or physician, to have them evaluate you and come up with a customized treatment plan for you. That is something that I do with all my patients, is give them a customized treatment program that best fits their needs. So while these are some of the top exercises I use, it is no guarantee that it will solve your problems specifically. But if you're interested and still listening, give these a try and see how they work. So the first thing that we're going to do for your sciatica is what we call a sciatic nerve glide. So what you're going to do is you're going to lay down just like this. My one leg is straight. I'm going to grab behind my other thigh just like this. I'm going to lay back and I'm going to kick up. I've got my toes pointed towards me, so my ankle is dorsiflexed, okay? And I go up to where I start to feel some tension. Now I've got tension right there in the back of my leg. And now I'm going to just point my toes in the opposite direction and then back towards me. So this is called plantar flexion. This is dorsiflexion. I'm going to do 10 of those each way. Just like this. And then I'm going to, once I get back to doing 10, my toes are pointed towards me. I'm going to try and go a little further to straighten my knee out as much as I can. I'm going to do 10 more. And then I'm going to try and go a little further and do 10 more. So what that does is that helps to glide that sciatic nerve through the neural canal and through the neural sheath that surrounds it. So next, what I'm going to do is now I'm going to keep my foot bent towards me, my toes pointed towards me, and now I'm going to do the same thing with my knee. So nice and easy, just bending and straightening the knee 10 times and doing a couple sets of that. So that's the sciatic nerve glide. That is the first exercise that'll give a lot of people that are dealing with some sciatic type issues. Now, with these exercises, when you're doing them, I do not want the symptoms to peripheralize or go down the leg. They should centralize and come out of the leg towards the butt or back and then eventually go away. So if they're getting worse and going down towards the foot and you're getting numbness into the foot, then you need to hold off on those. Those are not the type of symptoms and reaction that I want to get. There might be some discomfort with it. That's okay as long as those symptoms are centralizing. The next exercise we're going to do is a prone press up. So I'm going to lay right here. I've got my hands under my shoulder. Now if you have shoulder problems, this might not be the best exercise for you, but I'm keeping my hips down and I'm pushing my chest up as high as I can. I'm going to hold this position for 3 seconds and then I'm going to go back down. And I'm going to do 10 of these for 3 sets. And the goal is keeping those hips down, getting as much range of motion through your low back as you can, getting that chest up off the table. And this might really work your arms. So again, if you have shoulder issues, that might not be the best exercise for you. But if you don't, give it a try. The last exercise that I'm going to recommend here today to round out my top 3 exercises for sciatica relief is going to be what we call a single leg RDL or Romanian deadlift. And with this exercise, what you're going to do, I'm going to stand sideways, you're going to stand on one leg. So if you have balance issues, this might not be the best exercise for you either, but stand on one leg. My knee is slightly bent on that stance leg. Now I'm not going to bend it any more than that. From my trunk to the other leg, I really want a straight line. So I'm going to hinge on this hip right here is where all my movement is coming from. I don't want my movement coming from my back, so I don't want to round out my back. So what you're going to do is you're going to kick this leg back, bringing your chest forward, hinging over that hip. I'm keeping my pelvis level, and then I'm going back like that. So just like this. Going to do 10 of those, and I'm going to do 2 to 3 sets of those. So that's going to round out my top exercises that I give patients for sciatica relief. And again, I recommend that if you've been having these symptoms for longer than 2 weeks, get in to see a physical therapist or a healthcare professional, a physician, to get a customized plan for you. And that really should be one of the key things that helps you. But give those a try, see if those give you some relief. Give me some feedback, comments below if you could, if you find these helpful, and any thumbs up would be great. Thank you so much for tuning in, and have a great day.